Hey everybody, Jim here. Today I want to share a little bit about my journey with single-sided deafness and a surgery that I recently had for a bone conduction hearing aid system. If you're researching this topic for yourself or for someone you care about, I hope this video will help. So what is single-sided deafness? And specifically, how did this impact me? Well, for me, single-sided deafness happened very suddenly. If we look at Google, what they say about it, it's a condition where you have profound or total hearing loss in one ear, but normal or near normal for the other ear. In my case, I actually have sudden sensorineural hearing loss, which speaks to the fact that I lost my hearing very suddenly. And this is the part I want people to really hear. If you suddenly lose hearing in one ear, treat it like a medical emergency. Don't wait. I didn't understand that fully at the time. And as a result, I was not able to have treatment that was effective. I know some folks who had a similar experience. And with my experience, just to give you a little detail, I was sitting in a meeting in Atlanta in 2010, 2011. And while I was in the meeting, I felt like my ear popped. And I was dizzy for less than 30 seconds. So I knew something was going on, but just finished the meeting, shook my head, and realized as I left the meeting that my hearing was significantly impacted. I went to the ENT doctor in Atlanta, good practice, and unfortunately, because they didn't have any history on me, basically said, you need a hearing aid, go down the hall. And I did. And I knew in my heart that was not right, that this was something bigger. So what I should have done is immediately said, no, that's not the case. Fast forward a week, maybe, I woke up one morning and now the hearing on this side is almost completely gone. And it's, if you try to use a hearing aid on this ear, it just amps up static, essentially. It sounds like a robot voice. So I went back to the same place. By now I'd ordered the records from an ENT in Greenville, South Carolina, where I'd had a relatively normal audiogram on both sides. And they saw the dramatic impact, moved me to another specialist in that same practice. She was wonderful. But long story short, you have a relatively narrow treatment window with this situation where things like steroids or other interventions may help preserve some of the hearing, but timing is really very critical. And in this case, the cause was likely viral. They said maybe autoimmune. But regardless of the cause, you should take this sudden hearing loss very seriously. So after many years of thinking about options, I decided to pursue a surgery to go after or pursue a bone anchor hearing aid system. A lot of folks refer to this as a BAHA. Or more specifically, in my case, it's a transcutaneous bone conduction hearing system. The particular system I'm using is an Oticon Medical Sentio. There are two types of BAHAs, and this is not cochlear, by the way. A lot of folks think that this is cochlear. Cochlear is different. Won't cover that technology here. This is a bone conduction hearing aid. Typically two types. One of them has a post that is inserted into the bone of the skull and protrudes through the skin. That's not what I got. Some folks with those have incredible success. Some say that the post never really heals. It just didn't seem right for me. Nor were some other options like a cross. Cross puts a hearing aid on both sides. Sound on this side is received by a microphone and actually sent to the hearing aid in this side. So you transfer it. I tried one, just didn't work. So, but I did try something where they gave you a band and you actually had a transducer pressed against your outer skin and gives you an example of what you might experience with a bone anchor hearing aid. And that was very positive, which is why, even though I waited several years, I decided to pursue this. Technology has come a long way, and you no longer have to have the post protrude through the skin. And that is what the Oticon Sentio is, and that's why it's called a transcutaneous. The device, and let's go to the website where we can actually see what this looks like. If you look at the website, apparently you have to be a dancer. Not really, but this young lady, you can barely see it, but if you look at her head, she's got an external device which you can see. Pretty information website, but this is the device, but there's a really good video here, which we'll take a look at. Let's go back here. And so essentially, let me make this bigger. So essentially, this is the device. It's in two parts. You have the implant, which looks like a double-sided lollipop. This makes it look really big. It's not that big. And this is the external device. So real briefly, the external device is connected. This portion, the silver portion on the implant, is a magnet. There's another magnet in here, and it draws it together. The gold portion is actually a coil. And if you've ever used a wireless charger on your iPhone, or in fact, an induction cooktop, uses the same technology. It's able to transmit information from this external device to the implant via a coil, which then activates the transducer. The smaller part down here at the bottom is a transducer, and you'll see here in a minute how that's actually implanted. So the device comes in a number of colors. I think I went with a gray. That's just where I am right now. And the external unit has the magnet, and there's no assembly to it. You just can put it in a case, pop it on when you need it, which is attractive to me if I didn't want to have to be wearing it in certain situations. It does have a battery, and so you do have to change the battery, obviously. And the sound, the big thing is that with single-sided hearing loss, obviously you can't hear from one side, but it essentially, your other ear is blocked by your head. So that's why you don't hear anything on that side. This addresses that by communicating that sound to your skull. And it's got an app. It's got some accessories. I didn't get any accessories. But the other half, of course, is this transducer and the implant. So what that comes down to is this device. The actual size is the lower part, the transducers, about 20 millimeters or 0.8 of an inch in diameter. The full length is about 60 millimeters or about 2.3 inches. So it's not very big. And the implant basically is a fairly straightforward procedure. Now, this is an illustration. This is not show actual surgery, but if you think this might make you a little nervous or uneasy, you may want to fast forward. But essentially what's done is the small incision is made behind your ear. And then once the incision is made, you move your mouse so that you can push the video forward. Once the incision's made, they basically insert or basically hollow out a little space in the skull bone. I say basically they use a router. It's not really a router, but they open up a little bit of the skull bone to make room for the transducer, which is a little thicker than the rest of the device. And then they drop the transducer in there, and the upper portion slides up above it, and it has a little bit of flex to it, so I can move my head back and forth and it doesn't bother me. You do have a little band that goes across it. The purpose of that band is so that if you have first it just keeps the transducer in place, but also if you were to ever have an MRI, you can have an MRI with this surgery, with this implant, but you do need to limit it to a 1.5 Tesla MRI. You get a little card that you carry with you. So if there's any questions by a doctor, you can pull the little card out. Same thing for airport security. If it ever caused an issue in airport security, you have a little card that explains what was done. And then that little band is secured with 2 little screws. And basically, you then add the external device toward the top, just above your ear, and that becomes the part that listens and transmits the sound through to the transducer. So what is surgery day like? The video that you saw here, I'm going to actually show you my surgical scar. So again, if you think that's going to be something that you would be uncomfortable with, just a warning. But basically, on surgery day, I go to the hospital. It is an outpatient surgery. In my case, I went to a full hospital, St. Mary's Hospital, an amazing hospital here in Richmond, Virginia. You can also have it done at an outpatient or a ambulatory surgical center. My insurance required me to go to the full hospital. And I went around 10 in the morning. Obviously, had someone take you. My brother took me. And even though I went in at 10, the surgery they didn't take me back for surgery until about 1. The surgery is done under general anesthesia. So once I woke up, I went home with some pain medication and a big packet of instructions. And trust me, you really want to read those instructions. I missed one detail. And one of the things I would say is the person you go with that's going with you, let them know that they should be prepared, because nurses and doctors will likely call or meet with them and share information. So they're going to be asked not just to drive you, but also to collect information that me as the patient under coming out of anesthesia probably am not the best position to receive that information. So the funny thing is, after the surgery, you've just had the surgery over here. In my case, it's the external part doesn't have stitches. It was used surgical glue. So they give you a protective device. I've said I now know how my dogs, I don't have dogs these days, but my dogs, if they ever had to wear the cone of shame, I now know how they probably felt, because I had what I call the bowl of shame. So this is just basically a foam bowl type shape with a Velcro band that goes around your head. You wear it out of the hospital. You wear it until you go to bed. I chose to wear it overnight. Well, I didn't choose. I thought I had to wear it through overnight. I'm glad I did, because it kept me from rolling over on that fresh surgical spot. But that's your bowl of shame. So I stayed at my brother's house, and like I said, he drove me to the surgery. He met with the doctor, and he got a couple calls from the nurses. He went and picked up my prescription at the hospital pharmacy so that everything was all collected and ready. When we went home, I didn't have to stop at the drugstore or anything like that. So how am I doing now? Like I said, I'm going to show you the actual surgery site. It's not particularly graphic, but it does show you. I'll show you 2 different scenarios. 8 days after surgery, and this is a video. So I guess to make sure that I don't run the video audio, so stand by with me 1 second. For those of you who know me, I use eCam, but I haven't used it for a long time, and it's like a bicycle. If you don't, well, I guess you don't forget. Bicycle, you never forget how to ride a bicycle. But if you don't use eCam, you may forget how to use all the details. But this... Sure, I'm unmuted here. This is a video that I took about 8 days after surgery. So you can still see the scar pretty predominantly. I had some bruising down below, and then definitely had some bruising behind the ear, which I'll show you. Again, it looked worse than it is. It didn't give me any pain after the first day or 2. I did take some pain medication, but all in all, it was I was really pleased. I took 3 three pain pills, 1 on the day of surgery, 1 the next day, and 1 the night before I went to bed. And then that was it. I had Tylenol. I think I might have taken Tylenol once or twice between then and now, but the pain actually went away pretty quickly. So I was pleased with that. To bring you more current here, 18 days after surgery, this is what things look like today. So you can see much, much better. And what I would say is I made the a choice to get my hair cut the day before. The nurse suggested that I not have my barber use a blade in case they would nick it, so that they didn't want any possible chance for infection. So I told that to my barber. She didn't give me my usual shaving my neck, and I asked to cut my hair much shorter than normal. And she was a little uncomfortable, but she definitely cut it way, way short. For me, that worked out well, because now as it's grown back in, you've seen that there's not a big spot that it's obvious that I was shaved around that surgically before the surgery. So I think that was pretty good for me. But nevertheless, I'm in the point today. I feel much, much better about how I look. I never had other than the first couple days where you could really see it, I was a little self-conscious. But now you can hardly see it. So what's next? The next week, I will actually get the external sound processor. I don't have that processor in my possession. And what I'll do is I'll make another video to share that experience with you, take you along with me into that experience, and we'll let you know how it goes. They do say that it will take a little while to get used to, and they have to tune it. So I'm not expecting perfection, but I am pretty excited to get to actually get the sound processor, and I'm excited to share it with you. So as I said, hopefully this video will help somebody else who might be going through a similar journey. If you'd like to like and subscribe, this channel is it kind of goes all over my my various interests, and sort of it's called Jim Out Loud, because it's basically me just talking out loud about things that are going on with me. So you're welcome to continue that journey. Other areas that I like are photography, and I'm a cybersecurity professional nearing retirement. And so I talk about those cybersecurity sometimes, and other things as well. So you're welcome to join here. Or if nothing else, come back for the next video, which should be posted in the next week or so, and see how I did getting the external sound processor. For now, well, I'll thank you for watching, and I will see you on the next one.